Okay, Jade, so I just want to check you over. So first thing, I'm just observing that she's not in any respiratory distress at rest. The color looks good. Not any accessory muscle use to increase work of breathing. I just want to check your hands. She's got pink nail beds with good capillary refill. I don't see any clubbing. Skin is warm and dry. And then looking at her neck, trachea is midline. I don't see accessory muscle use. So then I would move around to the back. So actually, I'll come around. You stay there, and I will come around this way. So, looking for any deformities and watching for any chest expansion dissimilarities from side to side. So I'm going to take a deep breath. Okay, it looks symmetrical. Now I'm going to put my hands on you and have you do the same thing. Go ahead. Okay, so she's got good symmetrical expansion bilaterally. Then I'm going to listen next. I'm just going to listen to your lungs. I'm going to have you breathe in and out through your mouth. Just go ahead and take nice full breaths.
Do you ever have any exposure to no, it's a desk.
Okay, that's good. Lungs are clear and equal bilaterally. I'm going to just feel, and I'm going to have you say the word 99, 99, 99. Repeat.
I'd like to go on walks.
I feel like there are any areas of consolidation where there might be increased vibration on one side. I'm not feeling any, so that's great. Then I would also, if I had noticed any adventitious sounds, I would have her try to cough, turn her head away from me, cough so that she can clear any of those sounds if there's any happening. Also, if there's wheezing, you might want to have her do like, or if you're suspecting that there's going to be wheezing, like I might, because she's complaining of cough, have her do a forced exhalation and see if I can listen for wheezing at that time. And then I'll listen for all of the noises. So I'm going to listen to your lungs, and I would like you to say E, E, E. And so I'm listening for consolidation and a change. Okay. And so that would change to an A if there is a sound, and then I would have you, I'm going to have you whisper 1, 2, 3, and just whisper, and those sounds would be transmitted louder if there's some sort of consolidation.
You didn't ask about family history, allergies, infections, alcohol.
And then I'll have you speak the words 99, 99, 99, and again, listening for louder sounds. So this is actually bronchoscopy. So the last one was whispered heterologically. And I can see myself doing Mickey Mouse when I'm at 99.
Yep, that's good.
Okay, great. That was perfect. Okay, then I would move to anterior chest. Again, observing, making sure that she's not short of breath, that there's no accessory muscle use, retracting, that respirations are even in labor, palpating to make sure that there's not any deformities or pain, any tenderness there. Okay, and then finally would listen and cheer.
I take my own raw feeling, then I'll go ahead and do the palpating for 2 times a day. Place my thumb, okay? Telling him with the 1,200
Like off the couch, she didn't drink it.
and
And I'm hearing predominantly vesicular sounds, as I should.
It had a question, it asked why you're thinking.
And of course you'll hear bronchial sounds more over the main stem bronchus, and if I listened more on her trachea, I would hear tracheal sounds. Done.
Okay.
So, report. Now I have to give a report to you?
Yes. Do you want some time?
Yeah,
You
give
can
me a
have
couple